I actually got in as a dental assistant originally into healthcare.
How did you transition to what you do today?
I got my official arthritis diagnosis, and it forced me to...
What is your role at these organizations?
So I'm not in the coding department with coders and auditors anymore.
How can health plans and providers work better?
There's this term in the industry, pajama time. And
what does the day look like for you as a risk adjustment coding educator?
Reports update every month. So if they just updated, I'm pulling reports, and then I'm interpreting that data and helping them see the bigger picture.
Where do you see the future of coding in healthcare?
Of course, AI is a huge topic there. It's being utilized and having its bump and start.
Welcome to Healthcare Journeys, the podcast where we explore the stories, experiences, and insights of healthcare professionals making an impact in the industry. Today, I'm thrilled to introduce Danielle Bagnell, a recognized leader in risk adjustment and coding education with over 15 years of healthcare experience. Danielle is currently a senior risk adjustment educator for a top Medicare Advantage organization and a virtual instructor for the AAPC. She also contributes as a subject matter expert, shaping educational content and certification standards for healthcare professionals. We're excited to dive into Danielle's journey and hear her insights on advancing coding accuracy, compliance, and education. Danielle, welcome to the podcast.
Hi, Claudia. Thank you. It's good to be here with you.
Yeah, good to have you. I'm very excited about this conversation. You're one of those people that I just know you have so much knowledge about the industry and so many acronyms after your name on LinkedIn. So tell us, what are your credentials? Like, just to start, what accreditations do you have?
Yeah, so as like most, I started out with the certified professional coder, and then I was auditing risk adjustment and thought I should get my CRC and validate that. So I got that, the certified risk adjustment coder. And I'd always been a personal goal to get my CPMA, certified professional medical auditor. So I got that. I was asked to by the company I worked for at the time. And so it was like, okay, great, this must be a sign. And then where I teach documentation, if that was important to me to have the CDEO, clinical documentation expert outpatient. And then of course, to teach, you have to be an approved instructor. So I have that one as well.
Well, there you go. If you guys want to connect with Danielle and see all of her credentials, connect with her on LinkedIn. You have a lot of experience in and collaborate with very important organizations within the coding space, right? Humana, AAPC, and you've done other things, and it's amazing. But just to get started in your journey, how do you get started in healthcare? Like, how did you say, I'm gonna just go into, because you mentioned you're a coder, so how did that happen?
It actually started in dentistry. So I had saved up and finally got braces in my early 20s, and I wanted to help other people get a smile they loved. But for me, it was a huge deal. And so I look up to people in scrubs, and I wanted my kids to look up to me. And I thought, how perfect. So I actually got in as a dental assistant originally into healthcare.
So you went into it from a patient care side.
Yes.
And how did you transition to what you do today?
Well, I was actually really enjoying it. I wouldn't have left. I reached the max of pay, and I just started waitressing nights and weekends to make it work. I was in love with it and was going to stay forever. However, I was walking a tray of instruments and couldn't take another step. I had such an inflammation attack, and I got my official arthritis diagnosis of ankylosing spondylitis, and it forced me to get out of the clinical side. And so they let me go to front office, and I wanted to advance there. So I went to the local trade school to try to enroll in their front office dental course. And the recruiter actually took the time to ask me questions and get to know me a little bit. And he said, with your background and, because I was going through a divorce and have 2 kids, he's like, you could be your own daycare and work from home as a medical coder. And I'm like, what is a medical coder? I don't know software, computer stuff. And he's like, no, it's the billing and coding that you do for dental, just for the whole body.
Oh, wow.
I'm like, oh, okay. And his wife was going through the course, so he happened to have a CPT book with him in his office, and he handed it to me, and I was flipping through the pages, and the illustration of the Halo appliance on a child, came up on the page, and I was like, wow, there's a whole nother world that I know nothing about that I would love to learn about, in school and then later in medical records. And so I was fascinated and hooked and went with it.
That's amazing. That's an amazing story. It's interesting how a lot of us in the healthcare industry, our journey started with a medical diagnosis of our own. Like we do go into healthcare, and you're not the only one. I mean, other guests, they have their own healthcare challenges, and that's the moment where, or they meet someone, and that someone, in your case, that person that was advising you, mentioned you should go into this. In fact, there was a guest who had a similar experience, but instead of an advisor, it was his girlfriend. It's like, you should be a medical coder. And he's like, what do you mean? And he used to work at an airport before, so like completely unrelated. And now he's very popular or famous, not famous, but like very recognized in the conference circuit within risk adjustment and quality improvement. So you probably know him, but yeah, it was a very similar experience. And like that, I've heard other stories. So interesting that it was meant to be, almost, right? Like you met someone who brought this, and now you're here, and you are extremely, you have a lot of experience, and you know your field really well. So it was a right move, absolutely. Do you feel so what happened after? So you said, like, okay, sure, I'm gonna do this.
Yeah.
You were going through a rough personal moment as well. It was kind of like a crucial moment in your life as well, right?
Oh, yeah, that was definitely a turning point. Being a medical coder has been such a blessing in my life and my kids' lives. So, I went through the course, and I actually was getting really discouraged because, in dentistry, I was ordering the inventory, and I was the lead assistant and the back office manager. Like, it took me maybe a week to find a job. It was very much so having a different experience with my CPCA and, in ICD-9, and I had my ICD-10 proficiency certificate and trying to find a job. And I actually was getting really discouraged. And one day a hiring manager called me and said, hey, I really like what I see so far in your application. Do you mind finishing it so I can have you in for an interview? I was so discouraged, I just gave up in the middle of it. And I was like, oh, okay, yeah, let me go try to remember which one that was and go do that. So I went in, and it was for an in-person position, not remote, but I was just excited to get my foot in the door. And she saw my dental, HIPAA documentation, codes, billing, all that stuff as valuable experience. She recognized that. She really appreciated it. And so she gave me a shot. And if you had quality and production numbers up, then in 6 months, you could request to work from home anyway. So that was my plan. My kids unfortunately lost their father unexpectedly before that 6-month mark. And she was kind enough to let me go home early and work remotely, sooner, so that I could be there for them out, after school instead of daycare or something else. So that was a huge blessing in their lives, going through that, to have mom around. Never, could have guessed that would have been something in our path. Also, it was, a better pay. And so I was able to, move out and get our own place with my kids. And, that was a major triumph for me personally. And, so that's how I got my first coding job. Was a manager recognized and called me in after I gave up halfway in an application.
That's an amazing story. And also, I'm sorry for your loss, and what your strength is. It's admirable. You have kids, you have to make it work, and you got into a field that you just didn't know much about, right? Like, I mean, you had some experience, but it's sort of like now I feel like fast forward to now, you have more accreditations. It gets more technical as you go, and it's sort of like an example of how there's no straight path to what we do, right? Like to what you do every day. People in this field, it's not like one day, oh yeah, I'm gonna go to school for risk adjustment. It just never happens that way. Nobody has that path. Nobody. I mean, I didn't know what quality improvement was before getting into this field, right? Like no idea. So fast forward to today. So now you're working with a very large organization in the space, Humana, and the AAPC, which is like the standard for education in this field, right? So what did you do as professional today? Like what is your role in at these organizations?
Yeah, so with Humana, I am a senior Medicare risk adjustment educator. So I'm not in the coding department with coders and auditors anymore. I'm with senior leadership. I'm with directors and managers and providers, and I, pull reports of their data and interpret it and look for educational opportunities to help them with compliance and best practices to be successful in their value-based contracts with us. And so I'm just there to help them and keep them updated with their data on our members that they serve, their patients, and that's what I do in my 9 to 5, my day job. And then Humana actually sent me to HealthCon 2024, and I made a promise to myself when I was going through treatments, because I had stage 3 melanoma, that I would get out of my comfort zone and start saying yes to life's opportunities. I was reflecting on my life and wondering how many people were put in my path that I was supposed to help that I didn't because I was too afraid to speak up. So I just started saying yes, like this podcast. Never done before. I just said yes. So here I am, right? So, I said yes, and I made it a point, instead of just sitting there with my coworkers, all, on our own little table of safety, went out and made sure to network and meet people that I had seen on LinkedIn, were really impressed with and wanted to meet. And one of them was an SME for AAPC. And I told her how I would love to help with the curriculum and the exam for the CRC, because I had taught over 100 students. I felt like I had some, input that would help. And she's like, well, great. Why don't you just be, I can get your name to the right people to interview to be an SME. And I was like, fantastic. I do miss teaching. And she was like, well, why don't I just get your name to the right people to interview to be a VILT instructor? And I was like, oh my goodness, I looked for the job ad and couldn't find it. She's like, no, you have to know somebody. You can't just apply. And I'm like, oh, okay. But she knew that I had made a risk adjustment school for the previous company I was with. And so she felt comfortable vouching for me at that point. And so I got those interviews, and obviously they worked out, but thankfully. And so I get to teach. I've always wanted to be a teacher. I was married at 17, so I didn't get to go to college and do all that. But I always promised myself when my kids were of age, I would go to school and get a degree to be a high school art teacher. But now my kids are 17 and 19 years old, and I get to teach with risk adjustment, with coding. So I don't need to go, do that. And I can already, have my teacher heart filled with the students in the classes, and I get to help out with SME projects, and I get to try to help make the process better, which makes the patient experience better in my day job. So I feel really well balanced and fulfilled right now.
Danielle, like you've accomplished so much already. You have, and also going through hardship, like losses, medical challenges. I mean, it is admirable. Like I said, it's also not an easy field, right? It's not an easy job. The job you do, you make it sound very easy, but it's really not. I mean, it is working for an organization like Humana, or teaching is not something that it just comes overnight, right? Like you require experience, like you said, perhaps a vocation to be a teacher. You need to have those personality traits to be able to do it. So as you were advancing and moving from coder, or like being in a group of in a team of coders to more of a leadership role within your professional, your role at Humana or other companies. What were some of the challenges that you encounter that professionally that you had to overcome that come to mind? Something that you think that was really difficult for me to overcome. It can be related to the industry as well, right? Like, as we know, this is a common subject matter. Yeah.
Well, so when I was, so I started out as an E&M coder, right? And I switched over to hospice, and they needed someone to teach the coding and documentation education to providers, which I was used to with, in the E&M coding. Then I became an auditor and would teach them, based off their trends, what I was auditing, what I was finding they needed help with this guideline or that code. But they also wanted it for the nurses and the management, and that was new for me. And the other gal was having too much anxiety, and I had told myself to say yes and push through. And so I got through those pre-presentation anxiety attacks, and which was a huge triumph for me. I had such bad social anxiety growing up. I had a terrible stutter. I was in speech therapy for it in my childhood. And so I never saw myself as speaking articulately and being able to, talk in front of important people and remember my own name. Like, there was such an extra, design for me trial that was. But I said yes and got used to doing that. And that was actually one of the reasons why I was hired at Humana, was that because I needed to be able to talk to management and present the education to them and things like that. So never would have guessed that would later help me with, with a better job, but was definitely something that that was something I had to overcome in a struggle. And I'm really glad that I did. And working as a hospice coder, the notes you read and the types of stories you hear, it was actually when I was going through my battle with cancer, and another patient comes to mind all the time. They had it on their face and they actually lost their eye over it. And all I could think was, and here I am worried about, a chunk of my leg. Like that's like, put it in perspective. It was a huge, help with me mentally that way as well. So there's more than just the working remotely and how that's benefited and blessed our lives. There's also the perspective and the things that you get to read about and see that, okay, I actually don't have it as bad.
Yeah, I mean, we often don't talk about the human aspect of things, right? Because coding, for people who I work with vendors who work with health plans or patient care, but it feels removed, right? Like, feels like you see a medical record and there's a name, there's a date of birth, there's diagnosis, there's notes, but it does not feel as close, right? As a doctor or nurse, and even then, they create some space between the patient and themselves, right? Like, it's not a personal interaction by any means, but what you're mentioning is true. Like, we don't often think about patients in that context. Like, well, what am I complaining? Like, look at, there's not human aspect to that, right? Like, for the majority of us, we see data and charts and reports. So it's a very interesting what you mentioned and how you were able to relate and the challenges that you were able to overcome. I mean, you're working with a very large organization, so obviously it was a huge challenge for you to overcome it, and you did it. I mean, you're doing great, and you have a very important role at your organizations in plural. I want to talk a little bit about providers, if you don't mind. You work with providers, and the provider conversation is always there for either health plans and the providers themselves, and how can health plans and providers work better, right? Like, have a better relationship, better communication. A lot of times health plans do request things from the provider, and the provider, perhaps there's a little bit of resistance, not in a bad way, but they have a lot of things going on, obviously, with patient care. What do you see are the top things that health plans and providers not need to care about to improve that relationship in your experience?
To improve that relationship.
Yeah, with providers. Or do you think that in your experience, have you seen that some providers are more difficult to work than others? Um, we can skip this question if you don't want to answer.
Well, there's this term in the industry, pajama time, and it's where providers spend all day with their patients, and then when are they supposed to do their notes and their paperwork, in their pajamas after dinner with their family if they got to, kind of a thing. And so that is very much so on my mind. I make very, very minimal requests, and this is my first time working for a payer, and so I didn't really know what to expect.
Right.
But from the contracting department to the, like every department that I our meetings with, and things like that, they're constantly talking about trying to avoid provider abrasion, especially at this time of year with the record retrieval efforts. We're constantly like, what benefit can we help with the patient? Do they know that we offer the patient a food card? Did they know, like, can we get that information to them with the holidays and they're lonely? Do they know that they can have that, at this center with these other people? Like, there's those kind of conversations are happening. Whereas before, had no idea, had, just kind of hoped maybe, but had no idea that on the payer side, they're individual people there too, and they have their hearts in the right place as well. So I really just feel like there's maybe an imagined what it's like on the other side, and then just having the time to even come together and kind of learn a little bit about each other that way. Of course, there's the business side of medicine. You have to be in business to be able to help people. So it makes sense, that like, hey, this prospective process would be, helpful for, making sure that these conditions aren't slipping through the cracks. And when you do see the patient, that you can, address these, help them manage these chronic conditions. Oh, and we'll pay you a certain amount for each one, just to help offset the costs for the those administrative burdens of having someone create that face sheet before that you see that member, things like that. Like there are some give and take and some partnership moves like that. It's just, there's so much unique individual details to it. That's probably the best high level answer I can give.
No, I think it's a great point you raise, and something that I had not heard before. There's sort of like a unique approach to each provider, right? I think it is important to what you've mentioned, to understand that there are people from both sides, right? And they're both trying to solve the issue. It's not like one side is resistant. They both want to resolve the issues. Providers do have a responsibility for patient care, but they also have administrative burden. They also want to go see their families after work, and payers have all the right tools and the great disposition to approach providers. It's just a matter of them coming together. That's a very positive way to look at things. So I appreciate that perspective. I've heard of how difficult that relationship is, right? Like how unresponsive providers are. But I think it's important to understand the reasons why they might be unresponsive, right? Like at the end of
a bad past experience, they could be too busy, they could be understaffed. I always assume best intentions. Always assume it's,
that's a great perspective. So what does a day look like for you as a risk adjustment coding educator at your job? Like what does an average day look like?
Well, it depends on if because reports update every month. So if they just updated, I'm pulling reports, and then for all my value-based contracts, and I have a couple of fee-for-service contracts that we're trying to help improve their processes. So if they do change to value-based, they'll be successful, because it doesn't do anyone any good if you're not ready for it, you're not successful. So and then I'm interpreting that data. Okay, what's I'm getting stats, but I'm also seeing like how many open HCC gaps are there? Are these people being reached out to or not? Like, just kind of finding those little things. I'm seeing, these members have already had an annual wellness visit and their dementia hasn't been recaptured. I just want to bring it to their attention and let them know, that that's a possibility that it's in the record, just didn't make it on the claim. Can you double check? Can you do an internal retrospective review? Things like that, just things that are, helpful. And again, I'm letting them know what their data looks like, because they only know what's in their EMR, right? They don't know that they went to the emergency room and got a prescription for something, because the bill comes to us, so we have all that data, but they only see what they can see. So I'm getting them that information and helping them see the bigger picture that we're seeing for that member. And then again, educational opportunities. This is the correct way to document and to code dementia. So if you happen to, find that in the documentation, this is the compliant way to do that. That we have codes for all these amazing details. And, if they're true, there's the higher level specificity for accuracy's sake, all the same HCC. So the HCCs are different, but they're on severity. All their RAFs are the same. So it really is just about accurately telling the patient's story and, having the data there. So anyway, sorry.
No, I think it's a great, it is great to confirm, right? Like what will be a day like? It's the right value, making sure that a patient story is told fully, right? Like every data point, which the provider may not have, every data point. So you guys do. So
yeah, and then by the time I meet with every group, it's a new month and there's new reports, and I do
new
all
reports. So you've had quite a journey. You've touched. I think what makes you so good at what you do is you touch many different points to get here, right? Like you've done many different pieces of this puzzle to get here, so you understand the big picture better than someone who he will just. I don't even think anyone could just insert themselves where you are right now, right? Like you do need that background, that experience that you have to do the job you do. But with all of that experience and that perspective that you have today, where do you see the future of coding and healthcare going? Like, where do you see your world? How do you see it evolving?
So of course, AI is a huge, topic and buzzword there. NLP has been helping risk adjustment coders for a while. It's being utilized and having its bumpy start, and billing and things like that. So obviously that's not going anywhere. It's just going to have to get improved and get more compliant as it goes. Honestly, to speak more to, Medicare risk adjustment, because that's my chosen focus, with extrapolation happening from payment year 2018 forward for RADV audits, and version 28 having very different coefficients and different things that map in the first place. But really the ROI on certified coders to get it right is more than ever. And I just see that as such an important focus. And that's kind of where I'm helping leadership during the day, but I'm also helping the coders, outside of that. I'm also, an individual, whether it's a student or I'm tutoring a current coder. I'm doing presentations nationwide for AAPC local chapters to help coders keep their certifications and credentials current with their CEU requirements. Just helping, get them. You'd be shocked how many coders don't even know about the coding clinic. Things like that, where it just because I can only touch so many charts as a coder or auditor, right? But if I can teach others, a ripple effect, it's gargantuan. So by the time, and so if I can help them be better at the charts they touch, and then they can teach someone next to them and they're better at the charts that they touch, and before you know it, you know what I mean? Like it spreads like that. And that's really exciting. And that's why I started MCDE. And so my maiden name is McDermott. So it's the first part of my maiden name, and it's Medical Coding and Documentation Education. And right now it's for, tutoring and education on the coder level, but I'm hoping to expand it into the consulting and helping providers directly, and, provider systems and things like that as well in the future. But anyway, that's important to me. I know my family loves and appreciates me, but like the message I got this morning from someone that I had tutored, saying how grateful she was that I helped her get through her CRC and believed in her to go and help her get places to apply as an auditor, and she got it and she loves it, and she never would have had the courage to try that on her own. Things like that fuels my fire. That tells me that I am helping people that were put in my path, and I am doing what I should be doing with my blessings and my talents. And that's what gets me up in the morning, keeps me going on all this, honestly.
Well, thank you for that, Danielle. I mean, I think it's a great perspective and a very human perspective, right? Helping others and making sure that people in the future who touch the data, patient data, like a chart, and they're able to interpret the data better, for all of us to be better, right? Like for all of the system to be better, everything starts with a chart, right?
Yeah.
The journey, everything starts with data on that chart. Well, I really do appreciate you being with us today, and sharing with us your journey, your story, and your experience. And we'll hopefully bring you back to learn more about the work you do for Humana and AIPC. Anything else you'd like to add?
No, just like you said, invitation for anybody who wants to connect on LinkedIn. I try to post things educational, and I'm happy to. I'm with AAPC's mentorship program. I am definitely happy to help. So if you need anything or have any questions, feel free to reach out.
Excellent. Okay, well, you hear it. Connect with Danielle on LinkedIn. Please follow S2M Health on LinkedIn to learn more about our podcast, watch future episodes. Thank you for watching, and until next time. Thank you.